So many people in Pakistan still believe that beauty or skincare is equals to whiteness.
There is a difference between whitening the actual color of your skin and between hyperpigmentation. I have a lot of Gen Z patients coming with their boomer mothers, and all they want is इसको चिटा करके दे, इसकी शादियाँ नहीं है, काली हो रही है ये. So
what advice you would give to young people who are just starting off with their skincare, especially for the people who have acne prone or very sensitive skin type?
These are normal hormonal changes. But when you're in your late teens to early 20s, I think at that point, if you're still having acne and it's getting worse and it's leaving you with scars or acne marks and hyperpigmentation and post-inflammatory marks, then I would suggest going to a dermatologist to figure out why this is continuing and getting worse.
And what's your take on the ongoing demand of non-invasive treatments such like PRPs or exosomes or lasers?
हमारा प्रॉब्लम पता है क्या है, हमें वन टाइम में सब कुछ चाहिए, एक ही बार में कुछ ऐसा कर दे कि मैं ना ऐश्वर्या राय बन जाऊँ, वो नहीं हो सकता, मतलब नहीं हो सकता. That it's stupid to expect that because there is no regulation in Pakistan as of now. There are literal quacks who are injecting people with glutathione injections and these whitening pills and giving them steroid-based special created creams that are sort of going to make you chitta overnight, and that absolutely does not work because you're just messing with your skin and you're actually making your skin more prone to cancer. Your skin is going to thin.
What would be that one universal skincare rule that you would advise everyone?
I think if this has been done to death.
Assalamualaikum everyone, welcome back to another podcast at Accufix. Today we have Dr. Palwasha Khan with us. So let's ask her about herself. Assalamualaikum Dr. Palwasha. How are you?
I'm good, how are you?
So please let us know about something of your experience and what about your interest in women health.
I graduated from Lahore Medical and Dental College about 5 years ago. Uske baad se I've been working in medicine, and then I got into the field of dermatology and aesthetics, and I've been practicing that for almost 3.5 years, 4 years now.
I also came to know that you have some special interest in women's health as well.
I've always been interested in women's health generally because I'm a woman. I think the biggest reason for that is that in Pakistan especially, and in third world countries or South Asian societies, there's a basic disinterest in women's health. Women's issues are not taken as seriously, and there's this inherent need to push down women's issues. Matlab, you're never taken seriously when it comes to hormonal health. People usually pass that off as, this is all drama, and my Ammi will never do that. And
yes, exactly.
So I think there's this very big sort of disregard in taking into the importance of how women feel, how their hormones have impact on not just their general menstrual cycles and fertility, but also on skin, on overall mental health, and on fatigue, and how women tend to feel more tired than men at the same age, and that is all because of hormones. So I've always been interested in that, and that's how it is. But even for skincare and skin, bad skin generally has a really bad and detrimental effect on your mental health.
Exactly. Yeah,
so people unfortunately do not take that seriously, and that's what I'm sort of trying to achieve.
As someone who values both clinical and dermatological side of aesthetics, what do you feel about brands like Accufix Cosmetics who actually provoke certified skincare dermatologist approved and someone who is actually formulated by a cosmetic scientist?
Honestly, when we were growing up in the 90s in Pakistan, and even in the US, because I studied in Canada for a very long time. I'm actually Canadian. So there has been a lot of advancements in skincare. However, brands that are coming up, everybody literally these days is coming out with their own skincare brand, which I just cannot wrap my head around, because there has to be certain sort of viability to the skincare that you're giving out. Now, the problem in Pakistan is that growing up in the 90s, we came across a lot of these random skincare brands, and Tibet Snow and Golden Pearl and Stillman's. And the problem is that while those things work, there was never good research that went into them, and there was no regulatory body to sort of keep a check on what is actually going in the product. Currently, in the past, I would say 5 years or so, there has been like a rampant increase in the number of skincare brands that have emerged in Pakistan. And what I love about brands like Accufix, and there are some other brands as well, is that there is some credibility to it. You know, you have a list of ingredients. That's something I look for when I look at a random product. The first thing I look for is a list of ingredients, because most of the skincare products that are coming out and like influencers these days, and everybody has their own skincare line, and then you open the product and there's no like ingredient list on it.
Exactly.
So that makes you question the integrity of the product itself,
Exactly.
which is why when I look at brands like Accufix, and there are a couple of very good other brands as well, which are, pharmaceutical grade skincare brands, I feel like that is sort of giving a credible sort of push to.
They are giving more transparency
Yes.
to the audience as well.
Yeah, and
as
I
to
think
the industry.
thanks to Instagram and social media and TikTok, people are so self-aware now of
Yes.
what they're putting on their face. There are people in there who are absolute like silly, and they're still using their golden pearl on their face, and then they come to us with such thin skin, and it's the barrier is completely damaged and everything. But I love how people are so self-aware of the sort of products that they have and the things they want to use on their skin. And even teenage girls, which is something that I really like, because when we were teenagers, at least when I was a teenager, I did not give any sort of crap about what sort of skincare am I using or whatever. It was
Basically, now things are more aware and more transparent to people.
So it's very important to have a brand which actually is transparent about what they're putting in and what they're promising when it comes to skincare.
Okay, so many people in Pakistan still believe that beauty or skincare is equals to whiteness. How do you believe that we can change that mindset towards to a progressing country or to a progressing mindset?
As a doctor, when
Because you're
I
a doctor, there must be a lot
still
of people coming towards
as a
you.
doctor, and I know a lot of my colleagues have gone through this, I still hear people asking for a gori chitty Dr. Bahu, So unfortunately, I don't think that element is ever going to leave the brown person mentality, because we are so in that, like, that whole idea of being gora and chitta is so ingrained in our minds, in South Asian minds, in India, Pakistan, Bangladesh, Sri Lanka, and वो एक आपको पता है एक notorious किस्म की एक पुरानी हमारी whitening creams चली जा रही है, वो तो उसके बगैर, और वो ad आता है तो पहले रिश्ता रिजेक्ट हो जाता है क्योंकि लड़की काली होती है, फिर वो क्रीम लगाती है, वो जादू से
वो सेंटिमेंट,
हाँ, वो 30 minutes के अंदर वो गोरी चिट्टी दूध वर्गी गोरी टाइप वो बन जाती है. So I feel like people should be happy in their own skin. When we talk about whitening products, I want to make it clear. There is a difference between whitening the actual color of your skin and between hyperpigmentation. Now, when a patient comes to me, what I look for is whether this is the actual color or whether this is actually hyperpigmentation. And because of that, they've, changed their skin tone and everything. And, people have patchy skin and they're So that's the sort of distinction that you have to make. Unfortunately, because there is no regulation in Pakistan as of now, there are literal quacks who are injecting people with glutathione injections and these whitening pills and giving them steroid-based, specific, special created creams that are sort of going to make you chitta overnight, and that absolutely does not work, because you're just messing with your skin and you're actually making your skin more prone to cancer. Your skin is going to thin. So there are elements to it. We need to get out of this mindset. Again, I will reiterate that there's two things. Either your skin has become darker due to a tan or hyperpigmentation, melasma, dark spots or acne marks and all of that. That is something that should definitely be treated, because obviously everybody deserves to have the skin that they should have. But when it comes to going lighter because शादी आ रही है और रिश्ता नहीं होगा और
bleaching,
मैं तो काली हूँ, मैं तो गोरा होना है, that complex we as a people need to get out of, unfortunately. But I don't see that happening anytime soon.
But I believe the Gen Z coming up or the generation we are in, we do not go for whitening. We always promote or
I
love the
don't agree
skin
with
we
that.
are in.
No, I don't agree with that. Maybe a certain percentage is slightly
People are
more
becoming
aware
more
than the
acceptable to brown skins now.
slightly, but not the way you would hope in 2025. So Gen Z, I have a lot of Gen Z patients. I have a lot of Gen Z patients coming with their boomer mothers, and all they want is इसको चिटा करके दे, इसकी शादी आनी है, काली हो रही है ये वो. So these are women in their late 40s and 50s coming with their 20-year-old and 25-year-old daughters, and they want to have the glow before their shadis, and college जा जाके काली हो गई है क्या. So unfortunately, we might think that we're more educated and all, and we're more self-aware, but it's still there, unfortunately.
What advice you would give to young people who are just starting off with their skincare, especially for the people who have acne-prone or very sensitive skin types?
So there's a sort of so I'm going to compartmentalize this into two age groups. Number one is prepubescent and pubescent children from the age of like 10 to 14, and then from like 16 to 24, right? Because this is like the younger generation. जो prepubescent है या मतलब वो people who are just hitting puberty. So these are normal hormonal changes. You technically do not need anything. Yes, if it gets worse beyond like a certain like degree where you feel like it's affecting your day-to-day life, or it's just making your face look really bad, or it's making you feel vulnerable, and there is obviously when you're a teenager, you're all the hormones and everything.
वही teenage में जब दाने आते हैं सोए जवानी के दाने निकल.
वो बहुत that really bothers people, and that's very genuine.
Yes.
I was lucky enough not to have horrible teenage acne. I had very minor teenage acne, but I had really horrible adult acne. This is like 3 years ago, and I was like in my mid-20s. So 3-4 years ago, so I had really horrible adult acne, and I had no idea how it happened. So that sort of makes you mentally go crazy.
Yes,
that every day you're having this acne, and your skin texture is bad, and when you're a girl, you're trying to apply makeup and it looks really bad. And
your
then
confidence gets shattered.
Yeah, your confidence gets shattered, especially when you're a teenager and people are bullies. Unfortunately, that's the reality of it. People make fun of you, and because someone will have like really nice glowing skin, on the other hand दूसरे बंदे का बिल्कुल बुरा हाल हुआ है.
किसी के मुंह पे जाना उसको पता है कि ठीक है, I'm having pimple, you don't need to tell me.
Unfortunately, we are not kind people. If someone is overweight, they know they are overweight. You don't need to tell them.
You have gained weight.
हाँ, you have gained weight. तो मोटी हो गई हो, मुंह पे दाने क्यों निकल आए? हाय अच्छा, इतने बाल क्यों निकल आए मुंह पे? तो वो मतलब हमारी कॉम जो है ना, वो नहीं आता उनसे, नहीं वो रहा नहीं जाता. वो बताए बगैर के मुंह पे दाने निकल आए, मुझे पता है ना, मैं रोज देखती हूँ. आप अभी देख रहे, मैं तो रोज दिन में 6 बार देखती हूँ. So for teenagers, I would say that if it's really bad, go to a dermatologist. Like tell your parents, go to a dermatologist. But acne is a part of growing up, teenage especially. So if it's not too bad, just like get a normal like salicylic acid cleanser, use it 2-3 times a week, and maybe someone can give you like a sort of like a small ointment or something just to keep the acne at bay. But that's about it. You don't need much. But when you're in your like late teens to early 20s, I think at that point, if you're still having acne and it's getting worse and it's leaving you with scars or acne marks and hyperpigmentation and post-inflammatory marks, then I would suggest going to a dermatologist to figure out why this is continuing and getting worse, as opposed to just because most people who will get teenage acne, it will resolve on its own eventually.
And what should be a general skincare for a general person for normal skin type in their teens or younger age?
Okay, so depending on the kind of skin you have, if you have too much oily skin, then I would recommend getting like a non-oil based cleanser and washing your face in the morning and at night, using any moisturizer. People who have oily skin, I would advise them to not take, like very oily skin, to not take oil-based moisturizer. There are a lot of gel-based and water-based moisturizers now. But however, that doesn't mean if you have oily skin, it does not mean that you can skip moisturizer altogether, because I think that's a very common misconception that people have, that oily skin है पहले ही moisturized है चिकनी है नहीं you need a moisturizer regardless of the kind of skin you have, and there are a lot of really good products in the market with like which are based on oily and really oily skin, because you don't essentially want to clog your pores, especially if you're having issues like acne and blackheads and whiteheads. Lastly, sunscreen, any type of sunscreen, but sunscreen. I put sunscreen on my 3-year-old daughter every single
Sunscreen
day.
is very
So
important.
that sunscreen throughout, like all your life, on your hands, on your neck.
Non-negotiable.
One thing people really mess up is that they don't put it on their neck and their like decollete areas. So you need to put it on your face and your neck and all of it.
Okay, so you're also a trained esthetician.
Yes.
So how do you maintain the difference between natural beauty and an aesthetic beauty?
Even if like I feel like all aesthetic doctors at this point will
Still, there is a borderline where the cosmetic beauty becomes a lot more.
This is the thing that in 80 to 90% of cases, it's never the doctor who pushes for really crazy sort of transformations. It is the patient who wants that crazy sort of, Kim Kardashian inspired sort of, and the duck lips, Kylie Jenner, and all of that. That is where like I feel like there is some morality to it. Like some things may not be for everybody. As of this point in my life, I have done nothing to my face. I'm in my 30s, early 30s, and I have done absolutely nothing. I've not done Botox yet. I should, technically, but I haven't. I have not done any fillers. I think about it sometimes, getting like a slight lip filler, then I'm like, that's good. Just overline my lips. So I'm an aesthetic physician myself, and I have patients like all the time who want fillers and everything. And I've actually had sort of mini fights with patients that please do not get this lip filler. You don't need it. Just let it go. Or like you only need like 1 ml. You don't need 3 ml. But then the thing is that if they're not going to get it done from you, they're going to go to someone else, which is fine too. I let them go, because you have to draw a line somewhere where you can't, because they're going to, when people go out and you've done work on their face and they are basically representing you.
They're your advocates.
Yeah, they're your marketing team, right? So when they go out in that look and when things have been overdone, that's when I think people will actually stop coming to you. So I have actually refused patients when it comes to fillers and threads and lifting, and even like people with this really nice jaw lines and chiseled faces, they still want like fillers to make it more chiseled, or they want like a lemon bottle to dissolve more fat. And I'm like, you realize that after this point, your skin will start sagging, or your filler is just like touching your nose. Like, come on. But I've refused patients, and I'm okay with that.
I believe after some time, when you get treated once or second, it becomes a habit that you want more and more.
See, that's the thing, because this is not plastic surgery, right? Plastic surgery is permanent, but like if I were to do my lips right now and slightly enhance them from here, it would look good to me for some time. And eventually, because we use dissolvable fillers and they go away, for some people, I mean, it depends on your body's metabolism basically, but it can last up to a year in some people. For some people, it only lasts like 6 months. So I think, like, for example, if I did it, after 6 months, it would start bothering me that, it's not looking the same, or I'm not getting that, look. But that is a continuous process, and it's a commitment. Yeah, I mean, like a half ml just to sort of accentuate your lips, or make your cheeks a little nicer, or help with the jawline a little bit. Okay, but I would never want someone to look completely different from what their actual face is.
Overdone of everything looks bad.
Exaggeration and overuse of anything is bad. So yeah, I've refused patients, and I'm okay with that.
Okay, and what's your take on the ongoing demand of non-invasive treatments such like PRPs or exosomes or lasers or chemical peels, etc.?
They're fantastic. I think non-invasive treatments are the absolute...
Because now people prefer non-invasive treatments more.
Because non-invasive is the best, right? You're not putting anything into your body. Yes. You're not injecting. You don't have to undergo like anesthesia or injections or needles, and no one has to cut you. So I'm a huge fan of things like PRP, face PRP, and microneedling, microdermabrasion. There's like a plethora of facials, laser-based facials. You can incorporate different like mesotherapies and mesoserums, and I love chemical peels. I absolutely love them for people with hyperpigmentation.
But there's also a lot of people who do them unregulatedly when it comes to non-invasive treatments.
That's
There's always a misuse.
in
of it.
Pakistan. Again, do your research before getting something. Unfortunately, हमारी mentality जो है ना वो ये है कि वो 3,000 में कर रहा है, आप 10,000 क्यों ले
Exactly,
रहे
there's
हैं?
a competition
तो
and
वो जो
prices as well.
competition
a
है
lot.
ना, people are जो 3,000 में कर रहा है chemical peel. I cannot believe anyone at this moment who is an actual doctor, an actual ethical doctor, can actually do like that cheap of a peel, because there's a lot of stuff that goes into it. The peels are expensive, everything is being imported, there's an import tax. So if someone is actually doing something, you are playing with fire, you're playing with your skin. And we've seen like a lot of patients with burnt skin, with the top 4 or 5 layers of the skin completely burnt off. I was actually with my professor once, and a patient came to him from like, I don't know, Faisalabad or Sargodha or someplace, and I could literally see the fat and flesh on her face because she had a chemical peel from somewhere in Sargodha, I think, or whatever, and her face had been practically burnt off. And she ended up actually needing plastic surgery after that to reconstruct her skin and everything.
Damage.
So I think that when, as a patient, errors can be anywhere. Doctors make mistakes. Doctors are humans at the end of the day. But when you're looking for someone to help you with face and all of that, make sure that they're actually a doctor. I wouldn't say just a dermatologist, like an actual doctor who's actually has like, you know, some sort of training in what they're supposed to do, not
Trained
just like
doctors.
random people who get up and start doing aesthetic procedures. I know like salons have these machines with aesthetic procedures, and they're doing lasers and carbon peels. And
lasers.
I'm sorry, I would not trust anybody with a laser who has no idea of like the frequencies and the wavelengths and the settings. Even if, you know, the people that bring the machines and everything, they teach you everything, you're still not a doctor. You still don't know the intensity. And sometimes people sort of, to accentuate results or to accelerate the rate of results, they give you a stronger dose or stronger laser intensity, and that is where things go wrong.
Yes.
हमारा प्रॉब्लम पता है क्या है? हमें वन टाइम में सब कुछ चाहिए, एक ही बार में कुछ ऐसा कर दे कि मैं है ना ऐश्वर्या राय बन जाऊँ, वो नहीं हो सकता, मतलब नहीं हो सकता. That it's stupid to expect that. So it's okay, but I think at the end of the day, it's up to the people and the patient themselves to research before going to someone for a certain aesthetic procedure.
Do your homework before getting it.
100%.
So how important is pH balance in cleansers? How do harsh chemical or soaps, washes damage the skin?
See, the skin of the face is different than the skin of the body, right? When you are looking at a cleanser, because obviously until you try something, you can't be sure if it works for you or not. So if a cleanser, any sort of cleanser that you've purchased on, depending on your skin type, right? If it feels like it's drying out your skin too much, if it makes your skin feel like too stretchy and like dry and pulled, sort of that feeling, then that might not be for you. Ideally, I would say give it about 2 weeks. Use it in combination with a moisturizer. If a cleanser leaves your skin feeling soft, hydrated, supple, then it's fine for you. But if it's making it dried out, if it has too many harsh chemicals, and especially products with a lot of fragrance in them, fragrance sort of tends to irritate people with sensitive skins, people who have eczema, people who might not know that they have eczema but have eczema-prone skin or slightly eczema skin. So, like, I mean, it depends person to person. Again, this is trial and error. I think I try a couple of face washes every couple of months because I have acne-prone skin, and not everything works for me.
Okay, and what about the soaps which people use?
Soaps. So I would not recommend using a soap on your
Because
face
even
ever.
today, there's a lot of big brands who produce soaps.
Produce soap, yes, and soap is still being used. And while it works for some people, I would never recommend using a soap on your face, at least, because it's too drying out. The materials and the chemicals used in soaps are too harsh. Generally, I mean, if I randomly go wash my face with like any soap, especially the really popular ones, my skin, it becomes really dry and it starts like stretching out, and it really bothers me. So soap for the face is a big no from my side. Yeah.
Most of the peoples nowadays do over exfoliation. So, what is the correct way to exfoliate, and how often you should exfoliate your skin?
So, the number one thing I will say is please stop using apricot scrub on your face to exfoliate. तो उससे blackheads और वो सब
Physical
कुछ निकल जाएगी. हाँ.
exfoliants.
Physical exfoliants are a big no for the face. Body, sure, but face, no. Exfoliation. Okay, so number one thing that you have to figure out is, do you actually need exfoliation? Because if your skin does not have like, okay, all skin has pores, but some people have more visible pores, some people don't. So question is, do you need the exfoliation, right? And then there are like sort of different sort of exfoliants in the market. There's daily exfoliants, there's weekly, there's monthly, then there's like proper chemical grade exfoliants like peels and all of that. You have to figure out which one is required by your skin. Do you need a daily exfoliant? I do not think anybody, unless they have really bad skin initially, needs a daily exfoliant, right? Exfoliants like lactic acid or like AHA, BHA, which are great exfoliants, I would recommend for like a normal sort of skin.
Many people nowadays do over exfoliation. So, how often one should do exfoliation, and what is the correct way to do that?
Okay, so again, the disclaimer here is that please stop using apricot scrub on your face and these physical exfoliants. You're just basically
Need them on face.
you don't need them on the face, and they're just damaging your skin. When it comes to exfoliation, there's AHA, BHA solutions, there's lactic acid, there's peels, chemical peels. So I always want to go for something again like a chemical-based exfoliant, no physical exfoliants on the face. You can use physical exfoliants on the body for some people, depending on the sort of skin you have. But for chemical exfoliants, it depends. Do you need it every day? Because I don't think anyone I know basically needs exfoliants every day. You can maybe do a weekly exfoliation with a chemical peel or a chemical exfoliant. You can use salicylic acid or AHA, BHA based toners 2 to 3 times a week to sort of exfoliate your skin. Some people may need more of it, but I mean, not everybody needs it. Maybe 2 to 3 times a month to exfoliate your skin, because if you over exfoliate, you're damaging your skin barrier, you're making your skin more prone to hyperpigmentation and all sorts of other things. So there's a moderation when it comes to chemical exfoliants, and for that I would recommend going to a dermatologist altogether.
So, what would be that one universal skincare rule that you would advise everyone?
Okay, so I think if this has been done to death, but sunscreen on your hands, on your feet, on all areas of your body that are actually exposed to the sun. Because we live in Pakistan, most of us tend to wear full clothing. We don't like expose ourselves like that. So on the face, on the neck, on the hands, on the feet, legs, depending on how much of your legs are exposed. But that, and generally for anyone above the age of 25, I would say get a retinol, but just be sure you're not trying to conceive or conceiving or pregnant, because you cannot use retinol. But retinol is the best thing that you can do for your skin when it comes to aging and sunscreen. That's about it.
So, last question would be, what would be the advice you would give to women to embrace their natural beauty and to shatter off the stigmas of society?
I feel like we as a people have put our own self-esteem and worth in the mouth of other people and how they see us and how they perceive us. Again, like मोटी हो गई हो, मुंह के दाने क्यों निकल आए हैं, चबी हो रही हो, so रंग काला हो गया, and all of that. So while I'm all for taking care of your skin, your hair, your overall appearance, But I would never want anyone to be so affected by someone else's words or the way people perceive them that they completely try to alter the way God made them. So there is a fine balance between all of this, and I think it's very important to know where you have to draw the line, because people will say what they want to say, or I mean, हम लोगों के मुंह नहीं control कर सकते, but we can control the way we think about ourselves, and there is a reason you were made that way, because I mean we all believe that, right? So there has to be a limit to how much you want to alter the way you look. Quite frankly, I don't really believe in altering yourself so much that you don't look like the same person. But taking care of your skin, getting facials, getting peels, threads to make your face look slightly more lifted, to look younger. I think everybody wants to look younger at the end of the day. So there is no reason to not get into these things. However, just not so much that you change your entire life. You make it all about just the way you look and what people think.
If someone says your lips are thin, you don't need to get
you don't need to get it. I mean, I always joke with my husband because he has really thin lips. I'm like, he has non-existent lips. My husband has literal non-existent lips. So I'm always like, क्या मुझे है नहीं नजर आ रहा कुछ. So this is this is a joke. So just before people think I'm being silly. Just because someone says your lips are thin, or someone says that you look older, or you look fatter, or you look like your hair, बाल ही नहीं रहे सर पे, जिसके गिर रहे हैं उसको पता है उसके बाल गिर रहे हैं. It's okay. Do what you can about it. If your hair is falling, do something about it. Figure out why it's falling out. Or if you feel like your skin has been looking really tired and fatigued lately, or you're getting hyperpigmentation, do something about it. But I would never want anyone to feel, low or just feel low or bad about just because someone else said something about them. It's life. You can't make everybody happy.
Obviously, and women body goes a lot.
Women's bodies go through a lot, especially during pregnancy. For example, people tend to get a pregnancy mask and lots of pigmentation, underarms and your private areas on your face. It's an actual term, pregnancy mask, where your entire face becomes sort of darker and hyper. I had it myself in my
melanin production.
Yeah, excessive melanin production causes that. So, and even after having the baby, whoever has a baby, uske baad, you're supposed to bounce back. No, you cannot bounce back. There is no bouncing back. Even 10 years later, there is no bouncing back. So you are not going to be the same. A lot will change. So you have to give yourself that space and room to breathe. And if someone is saying something, one ear, the other ear out sort of situation, because you should make yourself happy and not make people happy.
Exactly.
People will never be happy. I would never want anyone to change the natural limits of who they are just to fit into a certain mold set by society. I wouldn't want that.
Okay. Thank you so much, Dr.
You're welcome so
It was so good having you today.
Thank you.
Thank you so much, everyone. Today we had Dr. Palwasha with us. Let's see you in another episode with Accufix. Thank you.